I'm Russell Gorley. I'm a doctor of physical therapy at the Fort Apache location for optimal therapy. Shockwave therapy is it's a non-invasive treatment. It looks very similar to ultrasound, but instead of using sound waves, it uses a low amplitude percussive force to affect the tissue. So the conditions that we can treat with shockwave therapy are a lot of overuse injuries, so tendinitis or tendinosis type injuries, tennis elbow, Achilles tendinitis, plantar fasciitis, golfer's elbow. We can treat some muscle trigger points. We can treat like areas of tightness as well with shockwave. Shockwave's also been useful for breaking up bone spurs. What it does is it strikes the area that we're working on, usually between 1 to 3 or 4 times per second, and we'll do that for 5 to 15 minutes. What that does is that transfers energy into the tissue. It can increase blood flow, it can break up calcifications, it promotes the healing process, it increases inflammatory chemicals in the area that help to remodel tissue. Yeah. Like down in here. What about here? Right. Like when I pinch to the side or if I push right on top? Sides. Okay. All right. So I'm gonna apply a little bit of ultrasound gel to the area. You can do it without the ultrasound gel. However, the head has a little like edge to it, and I don't want it to like scrape up your skin. All right, ready? So during treatment, you should expect, it really does feel like getting flicked a bunch or hit by a reflex hammer a bunch of times for several minutes. Sometimes it can be a little tender. It can be, I think it's a little on the loud side, but it just feels like that. A lot of times we'll use ultrasound gel to kind of help the tool slide over the skin, but it's not necessary. And for a larger area or a larger, like if I was gonna do the calf or something, I'd use a larger attachment that slides a lot better without the ultrasound gel. So the protocol for this is to do about 1,000 strikes, and this is at 3 hertz, so 3 strikes per second. Or pulses, I guess we could call them pulses. You can expect some soreness, like muscle soreness, like if you did like a workout type soreness, or sometimes it can be a little tender to the touch just because it gets hit a bunch. And then you'll expect a reduction in symptoms because it's helping to improve the quality of the tissue in the area and reduce chronic inflammation. All right. Yeah.
Like my left is still sore, and it wasn't
Yeah.
as sore as the one on the right.
Really?
And it still feels like
The right one feels better?
Yeah, the right one definitely.
Cool. I think that some of what you're feeling, there's probably a little endorphin release. And so the immediate effects of it are probably from that endorphin release. Okay. The most common one is pain in the heel right here in this area, particularly first thing in the morning or after sitting for long periods of time. So pain in the bottom of the foot, sometimes it'll radiate up towards the toes, especially when you're like first getting out of bed, first few steps, and then if it, like starts to relieve after 10, 15 steps, that's usually the beginnings of plantar fasciitis. Your symptoms seem to be a little more of what's called a peritendinitis, which is there's a sheath that covers the tendon. That seems to be what's inflamed versus the actual tendon being inflamed. And so the shockwave getting there could be breaking up adhesions along the peritendon, which helps free it up and make it like move a little more naturally and allow the tendon to move a little more naturally underneath it, which could cause some of that reduction in pain, but it's probably mostly due to endorphins. But long term, the shockwave promotes blood flow, It promotes kind of the positive aspects of the inflammatory process. So with tissue remodeling, it helps clear out like the crummy tissue and allow the body to replace it with good quality tissue. So if you are running and you have old shoes, then that can lead to plantar fasciitis. If you are a server, or you have a job that requires a lot of walking, you work in housekeeping or something, work in a warehouse, and your shoes are old and they don't offer the support your feet need, then that can lead to plantar fasciitis. Our body relies on our shoes for a lot of stability when we're walking, and if those shoes don't offer that stability, we're asking the shoes to do something that they can't provide, and that changes how our feet interact with the ground, and that puts extra stress on that plantar fascia. A great way to check at home if you are kind of more at risk for plantar fasciitis is go ahead and stand up and just stand flat on the floor, and I want you to try to lift your big toe up. Okay, good. Yeah, so if you can't lift your big toe up, then you're at a higher risk of developing plantar fasciitis. Okay, hop back up there. Okay, so today we're gonna go over kind of some of the main things that I look for with plantar fasciitis. Some of the kind of telltale signs that I'm gonna look for if I'm seeing somebody that has plantar fasciitis, what impairments we usually like to address. And then to give some relief, immediate symptom relief, we're gonna go over what's called a modified Lodi taping technique. And then I also like to test for ankle strength, specifically with this motion, which is inversion. So hold, resist, good, nice and strong. Awesome. Okay, let's say you did have plantar fasciitis. What we're gonna wanna do is address the impairments that you have. So if it's weak, we wanna strengthen it. If it's tight, we wanna loosen it. If it's poorly controlled, we want to improve the coordination and control of it. In the short term, one of the great things that we can do to improve that control and reduce stress on it is to tape it. In this technique, I'm using leukotape, but you can use athletic tape as well. Kinesio tape would not be useful for this technique. But what it does is it helps support the arch of the foot, and it takes pressure off of the plantar fascia so that it can start to heal, while the exercises that we do in therapy and while the manual therapy treatments, whether it's shockwave or instrument-assisted soft tissue mobilization or massage or manual stretching or any of the things that we do in therapy, start to take effect and make changes to the tissue, we have the taping technique, we have the tape to help support the plantar fascia so that it is not painful in the short term. This strip goes on top like this. And go ahead and pull your foot back like that. Thank you very much. I've tried putting this tape on my own foot, and it's very, very hard to do on your own foot, but it is pretty easy thing to put on other people's foot, except I messed up that strip tape. I want to try to avoid wrinkles in the tape because it can cause blisters or cuts in the skin. All right. So this strip here is an anchor. I'm going to pull pretty firm. Can you feel that? Mm-hmm. All right, and then I come around the heel. I don't apply any pressure, and then I come up and I'm pulling pretty firm again. All right. Now, I'm gonna start right on the bottom of the heel, about 3/4 of an inch up from the back of the heel. And I'm going to push evenly, pretty hard. So I wanna feel you move a little bit on the table. And then I'm overlapping by a half a tape width on each. Like so. There we go. All right, and now we close it up. So with any taping technique, the weak point of it is, if it's gonna like fall off, is if there are corners or ends to the tape. So we wanna try to seal up all the corners as best as possible. I'm gonna put another horseshoe on there. Same thing, I'm gonna start on the inside of the foot. I'm gonna pull down, nice nice and loose across the heel, and then pull up tight. Okay, and now we're going to close up this top, this last anchor. All right. Actually, we'll go this way. It's not as pretty, but it works better. All right. So with this, the only edges are right there. So it's really sealed up. So this tape job will last most people about 3 or 4 days. It'll provide symptom relief from plantar fasciitis. They can swim in it, they can sit in a hot tub, they can get it as wet as they want, and as long as they don't try to peel it off or really like scrub it, then it'll adhere back down and it'll continue to support. To remove it, you want to slide the scissors, and they can be literally any scissors because it's not sticky right here. You can slide scissors up underneath it, snip the tape, and then peel it off. So I find that to be a really helpful way, especially early on in plantar fasciitis, to manage the symptoms. You know, maybe somebody's waiting for their custom orthotics, or they just have to like go hiking with their family and they just need some relief. I find this to be a really, really helpful technique for getting people kind of back a little bit sooner while we wait for all the exercises to start working. Will plantar fasciitis go away eventually? Sometimes yes, sometimes no. It really kind of depends on the person and what they're doing. If the plantar fasciitis is caused by, you know, if I decide to suddenly start training for a 5K and my shoes aren't great and then I start resting again afterwards, yeah, it'll eventually go away. If my overall activity level or lifestyle doesn't change, then no, it usually won't go away and it'll progressively get worse. One of the things that I've found is the longer that we have plantar fasciitis, the harder it is to resolve. The changes to the foot become a little more set, and it takes a lot longer to resolve those. If it's, you know, if you have plantar fasciitis for a month or two, it's much, much quicker to resolve and become symptom-free than it is if you deal with plantar fasciitis for 2 years. One of the worst things that we can do is to let lingering pains linger for too long. So if you are experiencing elbow pain that's not going away, or calf pain, foot pain, knee pain, any sort of pain, especially if it seems to be like a tendon hyperrelated pain, Shockwave could be incredibly beneficial for you. So give us a call, we can get you in, we can work with Shockwave, we can do other sorts of treatments, and if you are experiencing plantar fascia pain, I highly recommend that you address it sooner rather than later, especially if you don't plan on doing a relatively significant reduction in your activity levels. If you have that pain in the bottom of your foot, if it hurts when you're first getting out of bed in the morning, those first few steps are killer. If that is what you are experiencing, please come in and see me so we can get everything properly diagnosed, find those impairments, relieve those symptoms, and make sure that they stay gone.